following portion of My Carolina is sponsored by
Ken and Amy Schaefer are the owners of the Schaefer Business Associates, and both are local licensed Medicare agents helping people choose the correct plans. Ken and Amy, thank you so much for joining us again.
Glad to be here.
Well, you brought along a friend today to help us out as well. We have registered licensed pharmacist and client, Charles Clifford. Charles, thanks for joining us.
Glad to be here.
Well, Medicare is something that is just so crucial that we talk about, that we understand, and that we make sure that our family members and ourselves are all signed up for what we need that's going to best serve us. You both are so passionate about helping people. Why is that so?
Well, we wanted to do something together as a husband and wife team where we could help people and make an impact. And what we saw in the health insurance industry were seniors that were being taken advantage of with junk mail, unsolicited phone calls, misleading commercials. We are a local resource. We're not paid actors or professional athletes, and we're a local resource that doesn't cost our clients a penny because the only thing they ask us to pay them is attention.
And that's priceless right there, because sometimes we'll look at these plans and we just don't understand what any of this jargon means because of a lot of it is medical terms or money. I know when I see dollar sign, I kind of go out of it and don't understand what's happening. So it's so important that we have people like you helping us. And Charles, as a pharmacist, you deal with people every single day that are dealing with these issues. Why is it so important that we choose local agents like Ken and Amy here?
Well, when Medicare Part D started, it was basically just 7 companies, and it was pretty simple. Now it has evolved, and there's a lot of companies, a lot of plans. People pick good plans, and then there's a lot of bad plans. And personally, that's the reason why I use Ken and Amy.
And speaking of plans, I hear there are a lot of changes that are happening this year, so it's even more important that we understand what a good plan is compared to a bad plan.
Yeah, absolutely. There are probably more changes, in particular with prescription drug coverage for both Medicare Advantage plans and prescription drug plans, and a lot of that's being driven by something called the Inflation Reduction Act. Some examples would be individuals who have very expensive drugs, like cancer drugs, for example, they're going to experience some savings in 2024 versus 2023. In addition, there's going to be more folks that are going to qualify for cost savings through a program called Extra Help, also known as low-income subsidy, because they've reduced or relaxed the requirements to be able to qualify for it. Now, a challenge there is that sometimes individuals don't really know that Extra Help exists or how to apply for it. And yet a third change is that we're observing many of the prescription drug plans, standalone prescription drug plans, the premiums are going up substantially, some by more than 50%.
Wow.
So when you listen to that, you realize that there's some positive things and some not so positive things that are taking place in 2024, which just highlights the importance of getting a review so that you can, work to make sure that your benefits stay high and your costs stay low in light of all these different changes.
Right, because those changes do sound pretty major. There's some steep increases and decreases that we're going to want to know about.
Correct.
Now, Charles, how is this Inflation Reduction Act, is it really going to affect seniors in a big way?
Well, the important part is, as I said, there's good plans, there's bad plans, and I've seen people over the years, they just pick a plan because they had somebody at a big box store say, this is what you need. Amy and Ken lead you away from those things and make it tailored to yourself.
Sure, and picking a plan, that's just crucial, but what's even more crucial is that we hit the deadline to do so. What is the timing?
So the annual enrollment period where anyone can make a change runs from October 15th through December 7th. So you have time, but we encourage you not to wait. And then if you've already made a plan selection, you can make an additional one if you think that first one was a bad choice. The way it works is the last plan that you select during that period is the one that you have for 2024.
Okay, that's good to know. So say we're one of those people who heard, this box is the good one to check.
Yep.
We can come in, talk to you. Does it cost anything to make any of these changes?
No, there's no charge. Again, we only ask them to pay attention.
Okay, so that's good to know that we can go in and fix and learn and benefit from all these changes and make sure that we're getting the most out of our plan.
Yeah.
All right, so we do this. We are family members, realize that we need some help. How do we get a hold of you?
Very simple. They can go out to our website, and there's a contact us link out there. The website is simply www.nextchapter, S as in Sam, B as in boy, A as in apple.com, or they can give us a phone call on 919-378-1156.
Very, very simple. Great to know that we have that opportunity to make those changes up until when?
December 7th.
So that is the big day that we need to remember.
Yep.
And then we can break down all of those other big numbers with both of you.
Yep.
Absolutely.
Yep.
Thank you both. Always a pleasure to have you in and discussing such an important issue. And thank you for bringing Charles, because you deal with this every single day. I can't imagine the different problems that you see that you wish they had come and talked to Ken and Amy.
Thank you for having me.
Thank you both
Thanks so
so
much.
much. We appreciate you.
The preceding was sponsored by